Hello and welcome back. My name is Mr. Abasa Glory. So I want to welcome you back to this channel. And if you are new, kindly subscribe and hit notification button so you'll be notified when other content are dropped. So going straight to what we have today, the first question says a chest tube is placed in a patient for hemothorax. What would you, the LPN, report to the nurse, or what would you, the RN, report to the physician? A. Chest tube is not bubbling. B. Chest tube drained 300 ml in the first 10 hours. C. Chest tube is not draining. D. Chest tube is intermittently bubbling. Among these options, which of them would you as a nurse report to the physician or report to, as an LPN, which of them will you report to the nurse? Patient with hemothorax. So let's hold on to this question and move on to the number two. Number two question says a chest tube is placed in a patient for a pneumothorax. What would you, the LPN, report to the nurse, or what would you as RN report to the physician? A. Chest tube is not bubbling. Chest tube drained 300 ml in the first 10 hours. C says chest tube is not draining. And then D says chest tube is intermittently bubbling. Now, what becomes the difference between A and number one and number two? Number one says hemothorax. Number two says pneumothorax. So let's hold on to these two questions. Moving on to number three. The third question says the water C chamber of the chest tube in a patient with pneumothorax and hemothorax breaks. What is the first course of action for the nurse? A patient with pneumothorax and hemothorax, the chest tube is broken. What is the first course of action for the nurse? A. Clamp the tube. B. Cut the tube away. Number three, submerge the end of the tube under sterile water. And the D part of it says unclamp the tube if it was initially clamped. Unclamp the tube if it was initially clamped. What is the problem? The water C chamber of the chest tube is broken and the patient have pneumothorax and hemothorax. What is the first course of action we are supposed to do? Are we supposed to clamp the tube? Are we supposed to cut the tube away? Are we supposed to submerge the end of the tube under sterile water, or are we supposed to unclamp the tube if it was initially clamped? Let's hold on, move to number four. Number four question says the water C chamber of the chest tube in a patient with a hemothorax breaks. What is the priority, the best action of the nurse? What is the best action? What is the priority of this nurse? A. Clamp the tube, cut the tube away, submerge the end of the tube under sterile water, unclamp the tube if it was unclamped. What's the difference between number 3 and 4? Number 3 and 4, number 3 says what is the first course of action. Number 4 says what is the best action of the nurse. What is the patient having? The patient's water C chamber breaks. However, the patient have pneumothorax and hemothorax. Let's hold on to number 3 and 4 and then move to number 5 and 6. Number 5 says you notice on the monitor that a patient has ventricular fibrillation, patient is unresponsive and there is no pulse. What is the first step in the management of this patient? You notice on the monitor that a patient has ventricular fibrillation, patient is unresponsive and there is no pulse. What is the first step in the management of this patient? A says place a backboard under patient back while patient is supine. B. Start chest compression. Patient with ventricular fibrillation, what is the first step in management of this patient? The patient is unresponsive. Place a backboard, is that the first thing to do? 2. Start chest compression, is that the first thing to do? Let's hold on and move to the number 6. You notice on the monitor that a patient has ventricular fibrillation, patient is unresponsive, and there is no pulse. What is the best step in the management of this patient? Place a backboard on that patient back while patient is supine. 2. Start chest compression. What is different between number 5 and 6? Number 5 is what is the first step? What is the first step in management of this patient? Number 6 says what is the best step in the management of this patient? Now, these questions look familiar, or rather look similar, but an understanding is required to be able to know what to go for. So before we attempt this question, I want us to have a look at what I refer to as chest tubes. Let's understand what are chest tubes. Chest tubes, why do we need chest tube? What are we to look out for when it comes to chest tube? So those are things we want to outline as we go into the question proper. So what are chest tubes? Chest tubes are tubes that are inserted into the pleural space of the lungs. Chest tubes are tubes that are inserted into the space called pleural space of the lungs. Now, what is pleural space? Pleural space is the space between the two sublayers of the lungs. Now, the lungs is covered by what we call the pleura. The lung is covered by what we call the pleura, and the pleura has two sub-layers called the parental pleura and the visceral pleura. Now, between the parental pleura and the visceral pleura is what we refer to as the pleural cavity. Pleural cavity, or is also referred to as the pleural space. Now, this pleural space or pleural cavity contains what we call the serous fluid that help to lubricate the two sublayers when the lung, there is rise and fall of the chest. Now, the question then is, why should our patient need chest tube? Why should our patient need chest tube? Now, chest tube are inserted for different reasons. Now, for chest tube to be inserted, number 1, it means there is something in the pleural space. There is something in the pleural space that we need to get out. Now, what are the things that we're not supposed to find in the pleural space that are there that we need to get out? Among them, number 1 is air. Probably there is too much air in the pleural cavity that we need to get out. 2, too much fluid. Probably there is too much fluid in the pleural space we need to get out. 3, it's possible there is blood. Too much blood, or there is blood in the pleural cavity that we need to get out. So what other condition or what other reasons why do our patient need chest tube? Remember, I said one of the reasons is because there's something in the pleural space and we need to get rid of it. Number 2 reason could be the fact that chest tubes are given or are used to allow the lung to expand fully. Chest tubes are inserted for lung to fully expand. And thirdly, chest tubes are also used or are also placed after cardiac surgeries. After cardiac surgeries, chest tubes are used so as to drain blood and fluid around the heart. Chest tube. Why do our patient need chest tube? Now, remember we said that among the first option, we said that there is something in the pleural space and we need to get it out. And I said it could be air, it could be fluid, it could be blood. So what then happens? What are the terms that describe the presence of these substances in the pleural space? Number 1, they call it pneumothorax. So when you say pneumothorax, what does it mean? Pneumothorax simply means that chest tube is inserted to remove air. When you hear the word pneumothorax, it means that we have too much air in the pleural space and chest tube is inserted for removal of air. 2, we have pleural effusion. pleural effusion. So when you say pleural effusion, it means that chest tube was inserted to remove fluid. Pleural effusion, chest tube is inserted to remove fluid. 3, we have hemothorax. So in hemothorax, it means that chest tube is inserted to remove blood. In hemothorax or hemothorax, chest tube is inserted to remove blood. Now, so also we have pneumothorax. In pneumothorax, it means that we have hem means blood and thorax, pneumothorax be air. It means that we have the tube is inserted to remove blood and air from the pleural cavity. What have I said? I said pneumothorax means the tube is inserted to remove air. Hemothorax, the tube is inserted to remove blood. Pleural effusion, the tube is inserted to remove fluid. And then pneumothorax means the tube is inserted to remove blood and air. So let's go straight to the first question we asked and see how to attempt it following what we just studied. Now, the first question we're told is that a chest tube is placed in a patient for hemothorax. Remember, hemothorax is blood. What would you, the LPNs, report to the nurse, or what would you, the RN, report to a physician? Hemothorax, blood. A, chest tube is not bubbling. B, chest tube drain 300 ml in the first 10 hours. C, chest tube is not draining. D, chest tube is intermittently bubbling. Now, we say hemothorax means chest tube is inserted to remove blood, to drain blood. Does blood bubble? Of course not. Only air that is seen bubble. Blood does not bubble, but air bubbles. It therefore means that anything that has to do with bubbling should be out of the way, because hemo means blood and you only drain blood. You don't bubble blood. So anything that has to do with bubbling should be out of the way. So number 1, chest tube is not bubbling, it's out of the way. Number A rather is out of the way. D, chest tube is intermittently bubbling, is out of the way. Why? Blood does not bubble, but blood is drained. So it therefore means that the answer we now have is between number B and C. C says chest tube drains 300 ml in the first 10 hours. Drains. So it therefore means that the chest tube is draining. We don't need to report that because it is working. Now C says chest tube is not draining. Why was chest tube inserted in hemothorax? Hemothorax, chest tube is inserted to drain blood, but C says chest tube is not draining. So it therefore means that it's an area of concern. If chest tube is not draining and chest tube was inserted for the purpose of draining, it means we need to report it. So the best answer for number 1 is C. Chest tube is not draining. The LPN should report to the nurse, or the nurse should report to the physician that the chest tube is not draining. So let's move to number 2. A chest tube is placed in a patient for pneumothorax. For pneumothorax, of course, remember pneumothorax is air. What would you, the LPN, report to the nurse, or what would you, the RN, report to the physician? A, chest tube is not bubbling. B, chest tube drain 300 ml in the first 8 hours. C, chest tube is not draining. D, chest tube is intermittently bubbling. Now, pneumothorax. Pneumothorax is air. Air bubbles. They don't drain air, but instead air is seen bubbling if it's coming out. So, what's the question saying? What would you report? If air is bubbling, so it therefore means that anything that has to do with draining should be out, because you don't drain air. So, Number one, chest tube is not bubbling. That is possible an option. Let's hold on. B, chest tube drain 300 ml in the first 10 hours. You don't drain air. So number two, rather B is out of the way. C, chest tube is not draining. You don't drain air. So B and C are out of the way. So the option we have is between A and D. Chest tube is not bubbling. Chest tube is intermittently bubbling. Why is chest tube inserted for pneumothorax? Chest tube is inserted to remove air. And one of the signs to show that air is coming out is bubbling. So if option A is saying chest tube is not bubbling, it's a sign of concern. D says chest tube is intermittently bubbling, so it's working. However, A said chest tube is not bubbling. So that should be an area of concern that I need to report. So number two, the best option is A, chest tube is not bubbling. That is an area of concern. We need to report to the physician, or the LPN need to report to the nurse. So that is for that. Now, before we move on to talking about the other question, I want us to divert and look at what I refer to as location of chest tube. Location of chest tube. Now, when I say location of chest tube, we are talking about which part of the lung is the chest tube inserted. Now, of course, you know for sure that the lung have an apex above and a base below. The lung have an apex above and then a base below. So if chest tube is inserted at the top, is referred to as apical chest tube. If chest tube is inserted at the base, it's called basilar chest tube. So the question is, why should chest tube be inserted at the apex, apical? Apical chest tube is inserted to remove air, because air is always at the top. Air is light. So also, basilar chest tube, which is inserted at the base, is inserted to remove blood or fluid. Why? Because of gravity. Due to gravity, blood fluid will be at the bottom. So if you need to remove air from the lungs, you use apical chest tube. If you need to remove fluid from the lung, you use basilar chest tube. So those are things we need to look at for. It therefore means that chest tube at the top, apical, the main purpose is air, bubbling, because what you are looking at for. So also basilar, which is the one at the bottom, you are looking at for drains. So if there is bubbling at the bottom, there's an issue. If there is drain at the top, there's an issue. So it therefore means that if, for example, an apical chest tube drains 300 ml of blood or fluid within the first hour, of course, this is bad. Why? Apical bubbling is what's supposed to occur. Bubbling is expected because air is why the chest tube was inserted to remove air. So also, if you have a basilar chest tube that is draining 200 ml of blood or fluid, that is what is expected, so there is no problem. So also we have it as if apical chest tube is not bubbling. If apical chest tube is not bubbling, of course it means there's something wrong, because that is inserted to remove air. So also if basilar is bubbling, it means there is something wrong. But if it is not bubbling, then it is a good sign. So those are things we should look out for. So another thing again we need to now ask ourselves is where the chest tube is inserted. Remember we talked about we have apical and we have the basilar. Now what you must understand, another thing again, is there's what we call unilateral and bilateral. Unilateral and bilateral. So unilateral simply means it's inserted on one side. Bilateral simply means inserted on both sides. So if a patient have pneumothorax, it means that bilateral pneumothorax, it means that apical chest tube will be inserted on both sides of the lungs. So also if we have unilateral, it means it's going to be inserted on one side. So that is that we need to look out for. Okay, so the other part we need to talk about before we draw a conclusion today is the part where how do I answer questions that has to do with water seal being broken. How do I attempt question that has to do with water seal being broken? Now, when water seal are broken for a patient who is on chest tubes, first step is to clamp. Why do you clamp? The purpose of clamping is to prevent air from entering into the chest. Clamping. So that's the first thing you do. After clamping, the next thing is to cut. That is, cut the tube away. Now, after cutting the tube away, the next thing is to submerge the end of the tube under sterile water. First, clamp the tube. While you're clamping the tube, you are clamping the tube so as to prevent air from entering into the chest tube. 2. Cut the tube away. Now, after cutting the tube away, the next thing is to submerge the end of the tube under sterile water. Why are you submerging it under sterile water? This is to prevent air from moving into the chest and allow content to move out of the chest, especially if it has to do with pneumothorax or pneumothorax, either of them. Now, the next thing is to unclamp the tube if at all it was clamped. I said the first step, clamp the tube. 2, cut the tube away. 3rd, submerge the end of the tube under sterile water. Now, submerging the tube under sterile water is the most important step. You're going to see questions that say which of them is the most important, which of them is the first step. So the first step, clamp. Second step, cut. Third step, submerge, which is the most important. And fourthly is to unclamp. However, clamping, cutting, unclamping, all of them must take place within 15 seconds. Why you doing all of that is to prevent complication. What are the steps again? Clamp, cut, submerge, unclamp. So let's go to third question, or the next question we have. The question says the water seal chamber of the chest tube in a patient with pneumothorax, hemothorax breaks. What is the first course of action by the nurse? This water seal chamber of the chest tube in a patient with pneumothorax or hemothorax break. What is the first course of action for the nurse? A. Clamp the tube. B. Cut the tube away. C. Submerge the end of the tube under sterile water. D. Unclamp the end of the tube if it was initially clamped. Now, for what we've discussed, what are the steps? Clamp, cut, submerge, unclamp. So the question is, what is the first course of action? Is it not supposed to clamp? Is that the first thing? 2, cut the tube away. Is that the first thing? Submerge. Is that the first thing? Unclamp. Is that the first thing? Of course not. So for what we've just studied, the best answer at this point is to clamp the tube, which is A. So let's move on to number 4. Number 4 question. Number 4 question say the water seal chamber of the chest tube in a patient with pneumothorax or hemothorax breaks. What is the priority, best action of the nurse? The water seal chamber of the chest tube in a patient with pneumothorax or hemothorax break. What is the priority, best action of the nurse? A. Clamp the tube, cut the tube away, submerge the end of the tube under sterile water, and D. Unclamp the tube if it was initially clamped. Now, if you look at this question, the priority action, the best action, that is what the question is asking you. Is it to clamp the tube? Is it to cut the tube? Or is it to submerge it? Or is it to unclamp it? Now, in this question, the priority action for the nurse is to submerge the end of the tube under sterile water. Because Doing so is to prevent air from getting into the chest. At the same time, this allows air or blood from the chest tube to get out. So it therefore means that the number 4 question, the best option is to submerge the end of the tube under sterile water. But compare it with number 3. What is the best? What is the first? First is to clamp. What is the best? The best is to submerge. So number 4 answer is C. So let's move on to number 5. Number 5 question say, you notice on a monitor that a patient has ventricular fibrillation, patient is unresponsive and there is no pulse. What is the first step in the management of this patient? You notice on the monitor that a patient has ventricular fibrillation, patient is unresponsive and there is no pulse. What is the first step in management of this patient? First step. A. Place a backboard under the patient back while patient is supine. B. Start chest compression. Now, a patient is unresponsive following ventricular fibrillation. What is the first thing to do? Of course, many people will go for start chest compression, which of course is what you are supposed to do. However, the question is saying what is the first? Now, as part of the rules of CPRO is that for you to carry CPRO must be done, chest compression must be done on a firm surface. Chest compression must be done on a firm surface. Imagine that the patient is lying on a supine position on the bed. What happens if the bed is sagging? You may discover that all your effort in trying to give CPRO will become wasted. So the first step in management of this patient is to put a backboard under the patient. Why? So as to create a firm surface, so that as you carry out your chest compression, it will be effective. So number 5, the best answer for number 5 is A. Place a backboard under patient back while patient is supine. First step in management. Number 6 say you notice on the monitor that the patient with ventricular fibrillation is unresponsive and there is no pulse. What is the best step in management of this patient? It's the same question, but the difference is what is the best. First one says what is the first. This is asking us what is the best. So A. Place the backboard under the patient while patient is supine. C. Start chest compression. Best at this point is asking us what is the of highest priority. The highest priority at this time is not to put a board under him, but the highest priority is to save him. How do you save him? Start chest compression. So number 6, the best answer is to start chest compression. Why? Your aim is to save him. But if you are to start chest compression, the first step is to put a board under him. So number 5, A is the answer. Place a board. Number 6, start chest compression become the next thing. Now, one more last thing before we close it out is, how do I attend to questions whereby the chest tube is pulled out? Chest tube get pulled out. How do I attend to question whereby the chest tube is pulled out? In such a question, the first thing you must do is take a hand glove and cover the opening. That's the first step. Take a hand glove and cover the opening. First step. If the chest tube get pulled out, take a hand glove and cover the opening. What's the opening? The opening where the chest tube get pulled out from. Take a sterile Vaseline gauze and tape 3 sides, not 4 sides. Tape 3 sides and open 1 side. Why you doing that is to allow air to come out. What have you done? At that point of using a Vaseline gauze to tape 3 sides, that is the best step. The first step is to use hand glove and cover the opening. Use your hand, cover the opening. That is the first step. But the best step is to cover 3 sides of the wound using Vaseline gauze. So that is how you attend to patient if the chest tube get pulled out. So this is where we'll drop it. So I'm going to drop other questions. Please look at them, analyze them, and drop your answers on the comment section, and let's see who is able to get all the questions as we move on. Thank you.